Hello everyone, now let us discuss about 2023 CPT coding guidelines for endocrine system. This comes under the surgery chapter and the code range is from 60,000 series to 60,669. Now under endocrine system which comes under surgery, we will be discussing about the various procedures regarding thyroid gland which come under the CPT range 60,000 to 60,300 and parathyroid, thymus, adrenal glands, pancreas and carotid body which come under the code range 60,500 to 60,669. And in order to refer pituitary and pineal gland, we need to see the surgery nervous system. Here we are not discussing this. Here we will be discussing only about thyroid gland, parathyroid, thymus, adrenal gland, pancreas and carotid body. Now coming to CPTs of thyroid gland. The first one is incision, which is given by 60,000. 60000 incision and drainage of thyroglossal duct cyst infected. Now coming to the excision CPTs, the first one is 60100. It is given for biopsy thyroid, percutaneous core needle. And if imaging guidance is performed, we need to refer the following radiology codes. And for fine needle aspiration biopsy, this is biopsy thyroid, percutaneous core needle. And for fine needle aspiration biopsy of thyroid, you need to refer the integumentary system codes. And for evaluation of fine needle aspirate, you need to refer these codes 88172 and 88173. The next CPT is 60200. 6100, 6200. Next, excision of cyst or adenoma of thyroid or transection of isthmus. Next is 60210. Parathyroid lobectomy, partial thyroid lobectomy, unilateral, with or without isthmectomy. Next CPT is 60212. Partial thyroid lobectomy with contralateral subtotal lobectomy including isthmectomy. Now the next CPT is 60220. Total thyroid lobectomy, unilateral with or without isthmectomy. Next is 60225. This is total thyroid lobectomy with the contralateral, that is opposite side also. Contralateral subtotal lobectomy including isthmectomy. And finally 60240. Thyroidectomy, total or complete. And for thyroidectomy, subtotal or partial, we need to refer 60271. The next CPT is 60252. Thyroidectomy, total or subtotal for malignancy with limited neck dissection. Whenever thyroidectomy is performed to treat malignancy and limited number of lymph nodes have been dissected, you can use this code 60252. And 60254 is thyroidectomy, total or subtotal for malignancy with radical neck dissection. Previously it is with limited neck dissection. 60254 deals with radical neck dissection. The next is 60260. Thyroidectomy, removal of all remaining thyroid tissue following previous removal of a portion of thyroid. And for bilateral procedure, you need to report 60260 with modifier 50. Next CPT is 60270. Thyroidectomy including substernal thyroid, sternal split or transthoracic approach. The next is 60271. Thyroidectomy including substernal thyroid, cervical approach. The next is 60280. Excision of thyroglossal duct cyst or sinus. The next is 60281. Excision of recurrent thyroglossal duct cyst or sinus. And for thyroid ultrasonography, you need to refer 76536. Now coming to next CPT 60300. It deals with removal, aspiration and or injection thyroid cyst. The CPT is 60300. For fine needle aspiration biopsy, you need to refer this following integumentary system codes. And if imaging guidance is performed, you need to refer this radiology codes. Below listed radiology codes. Now let us see an example. Under general anesthesia, the physician excises the lower 1/3 portion of the right lobe of thyroid. Here partial thyroidectomy is performed, as well as lower 1/3 of the left lobe, that is contralateral. Right lobe is removed and left lobe is also removed, and isthmus is also removed. So the CPT is 60212, partial thyroid lobectomy with contralateral subtotal lobectomy including isthmectomy, because here isthmus is also removed. The CPT is 60212. Let us see some more examples. Physician performs subtotal thyroidectomy for malignancy. Subtotal thyroidectomy for malignancy with removal of only few selected lymph nodes. So the appropriate CPT is 60252. Thyroidectomy total or subtotal for malignancy with limited neck dissection. Because here only few selected lymph nodes have been removed. Let us see one more example. A patient has a total thyroidectomy. Previously it is subtotal thyroidectomy. Here total thyroidectomy to remove thyroid cancer. Removal of all the lymph nodes. Here all the lymph nodes are removed along with the spinal accessory nerve, jugular vein, sternocleidomastoid muscles, and it is performed to remove a malignant lymphatic chain. Here the CPT is 60254. Thyroidectomy, total thyroidectomy is performed. Thyroidectomy total or subtotal for malignancy with radical neck dissection. Now coming to CPTs for parathyroid, thymus, adrenal glands, pancreas and carotid. First coming to excision CPTs. The first one is 60500. Parathyroidectomy or exploration of parathyroid. And for re-exploration of parathyroidectomy for re-exploration, the CPT is 60502. And parathyroidectomy with mediastinal exploration, sternal split or transthoracic approach, the CPT is 60505. Next is an add-on code plus 60512. Parathyroid autotransplantation. It is listed separately in addition to the primary procedure because it is an add-on code, and use 60512 in conjunction with either 60500, 502, 505, 212, 225, 240, 252, 254, 260, 270 and 271. Next CPT is 60520. Thymectomy, partial or total trans-cervical approach. The next is 60521. Thymectomy, sternal split or transthoracic approach without radical mediastinal dissection. The next is 60522. Thymectomy, sternal split or transthoracic approach with radical, previously it is without, now it is with radical mediastinal dissection. Now let us see example. The physician removes the thymus gland of a 28-year-old female with myasthenia gravis using a trans-cervical approach. Here the approach is trans-cervical. Blood supply to the thymus is divided and thymus is dissected free from the pericardium and thymus is removed. So the appropriate CPT is 60520. Thymectomy, partial or total trans-cervical approach. Let us see one more example. A patient with MENI, multiple endocrine neoplasia 1, has surgery to remove 3 of her parathyroid glands and part of 4th parathyroid gland. Here the CPT is 60500. Parathyroidectomy or exploration of parathyroid. Now coming to CPTs for adrenal gland. 60540 is given for adrenalectomy. Ectomy means surgical removal. Adrenalectomy, partial or complete or exploration of adrenal gland without biopsy. Transabdominal, lumbar or dorsal. The next is 60545. Adrenalectomy, partial or complete with excision of adjacent retroperitoneal tumor. And do not report 60540 and 60565 in conjunction with 50323. And for bilateral procedures, you need to report 60540 with modifier 50. And for excision of remote or disseminated pheochromocytoma, you need to refer the CPTs 49203 and 49205. And for laparoscopic approach, adrenalectomy with the laparoscopic approach, the CPT is 60650. That we will discuss next. The next CPT is 60600. Excision of carotid body tumor without excision of carotid artery. The next CPT is 60605. Excision of carotid body tumor with the excision of carotid artery. Now coming to laparoscopy CPTs. The surgical laparoscopy always includes diagnostic laparoscopy. To report a diagnostic laparoscopy, peritoneoscopy, separate procedure, you need to use 49320. So coming to here, the CPT is 60650. Laparoscopy surgical. Laparoscopy surgical with adrenalectomy, partial or complete, or exploration of adrenal gland with or without biopsy, transabdominal, lumbar or dorsal approach. The next is unlisted laparoscopy CPT for endocrine system 60659. And finally coming to other procedures 60699. This is unlisted procedure endocrine system. Now let us see an example. A patient with a right side benign adrenal adenoma has a laparoscopic adrenalectomy. Here adrenalectomy is with laparoscopy. So the CPT is 60650. Laparoscopy surgical with adrenalectomy, partial or complete, or exploration of adrenal gland with or without biopsy, transabdominal, lumbar or dorsal. By this we complete the endocrine system of surgery. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.